The investigational study drug is currently being tested and has not been approved for use. Any claims of safety and effectiveness can only be made after health authorities review research data. Please talk to your study doctor about any risks or concerns you may have before starting the study. Before a new medicine is approved, a team of doctors and researchers must complete research to make sure the medicine is safe and that it works. This type of research is called a clinical study. To include participants in a clinical study, the study doctor must explain the study and ask for their permission. This is called getting informed consent. Informed consent is important to make sure that study participants understand several key things: what the clinical study is, the length of participation, what is being done, how to contact the study doctor if they have questions or concerns, and the potential risks and benefits of taking part. Understanding this will help you as a potential study participant to make an informed decision about whether or not you want to participate in the study. Before participating in a study, you will be asked to review, discuss, and sign an informed consent form. The study doctor will answer any questions you may have to help you understand the study. You should only provide consent once you understand what will happen if you take part and agree to take part voluntarily. You are being asked to consider taking part in the FENhance study because you have relapsing multiple sclerosis, or RMS. FENhance is a clinical study program that will include about 1,400 people between the ages of 18 and 55 living with RMS. The study is researching an experimental drug called fenebrutinib. This means that the drug has not been approved for the treatment of RMS by health authorities. In order to find out if fenebrutinib works in people with RMS, we are comparing it to teriflunomide, a drug that is approved for the treatment of RMS. This study has several parts. The first part is called screening and lasts approximately 6 weeks. During this time, your doctor will talk to you about your health history and perform some tests to make sure that you can participate in the study. If you're eligible to participate in the study, you'll enter the second part of the study called the treatment phase, where you'll receive the study drug. This phase will last for at least 96 weeks, up to approximately 4.5 years. We'll discuss the study treatment and study visits in more detail during the treatment phase a little later. After the treatment phase is completed, you will enter the third part of the study called the safety follow-up. The safety follow-up is when your study doctor will check on you to ensure that you are doing well after you have completed the study treatment. This phase will last approximately 8 weeks. In total, the main part of the FENhance study will last up to approximately 4 years and 7 months. There may also be an option to participate in an open-label extension phase, where you will receive only fenebrutinib and continue to complete study visits and tests. The open-label extension, if available, can last up to approximately 2 years. Let's go over the treatment phase in greater detail. The treatment phase is also called the blinded treatment phase because you'll be randomly assigned by a computer to one of the 2 study treatment groups. No matter which group you are in, you will receive both an active study treatment and a placebo. A placebo looks like a drug but has no active ingredient. If you are in Group 1, you will receive fenebrutinib and a placebo that matches teriflunomide. If you are in Group 2, you will receive teriflunomide and a placebo that matches fenebrutinib. Fenebrutinib is given as 2 pills 2 times a day for a total of 4 pills a day. Teriflunomide is given as 1 pill per day. Both are given by mouth. In either group, you will take a total of 5 pills a day, but neither you nor your doctor will know which is the active treatment. You will be asked to write down every day that you've taken your treatment dose. During the blinded treatment phase, you will have study visits at your research clinic site approximately every 2 weeks for the first 4 months, then monthly until month 6 of the study. and then every 12 weeks thereafter. Some visits may last up to 4 hours. During these visits, your overall health will be monitored closely by the study doctor. During the screening phase and the blinded treatment phase, you will need to complete a number of MRI scans of your brain and spine. An MRI is an imaging test that uses magnets and radio signals, but does not give off radiation, to form pictures of the brain and spinal cord. The study team may call you in between study visits to check if there were any changes in your health. At any time during the study, you may choose to leave the study entirely. If during the blinded treatment phase you wish to stop receiving study treatment but stay in the study, you will continue to attend study visits with less procedures. You will work with your study doctor to determine if other treatment options which have already been approved for RMS are right for you. Throughout the study, you will complete various assessments. Blood and urine samples will be collected to check the status of your health. If you are a person of childbearing potential, samples will be used to confirm whether or not you are pregnant during the course of the study. Physical and neurological exams will be completed. The neurological exam may include checking your mental status, how your senses are functioning and coordination. Vital signs including your temperature, pulse rate, blood pressure and breathing rate will be measured. Electrocardiograms or ECGs, which measure the electrical activity of your heart, will be completed. You will have to complete tests that assess your disease progression, and you will have to complete questionnaires on a tablet about how you're feeling and your daily activities. For this study, you may also need to undergo a procedure called Accelerated Teriflunomide Elimination Procedure, or ATEP. ATEP is the process of taking a medication to remove teriflunomide from your body more quickly than your body would naturally. There may be certain situations where this needs to be done. For example, if you become pregnant. This process takes approximately 11 days. During the course of this study, your health may or may not improve, but the information learned may help other people living with a similar condition in the future. Sometimes the study drug or procedures during the study may cause side effects. The informed consent form describes the known side effects of the study drugs. Talk to the study doctor about any concerns you may have. Your health will be closely monitored, and you must contact your study doctor immediately if there are any changes to your health. While participating in the study, you must agree to take certain precautions, including not taking certain medications and avoiding certain foods. Your study doctor will provide you with these details. There are also risks in exposing an unborn child to study drugs, and all risks are not known at this time. Therefore, women and men must take precautions to avoid exposing an unborn child to the study drug and agree to use contraception throughout the study. If you are a person of childbearing potential, you must also agree to take monthly pregnancy tests at your study visits and at home. During your participation in the study, all drugs and procedures necessary for this study will be provided at no cost. If you get injured because you took part in this study, please contact your study doctor as soon as possible. They will explain your treatment options and next steps. Remember that your participation in this study is completely voluntary. At any time, you can choose to stop participating in the study for any reason. However, please discuss your decision with your study doctor to ensure you stop participating safely. Before you make a decision, please read the informed consent form in detail and review potential risks. Prepare any questions you have for your study doctor. Joining a clinical study is an important decision that you may want to discuss with your family and friends. Please take all the time you need to decide if this study is the right choice for you. Thank you for considering participation and helping to advance clinical research.